The Centers for Disease Control and Prevention reports that between 1965 and 2014, the number of premature American deaths caused by smoking and exposure to secondhand smoke is a staggering 20,830,000 people. That's almost 21 million people over the last 50 years. Coming up on Health Watch, a look at the 50th anniversary of the Surgeon General's report on the dangers of smoking. Stay tuned. Hello, I'm Terrence Affer Anderson, and this is Health Watch. On January the 11th, United States Surgeon General Luther L. Terry released the first report of the Surgeon General's Advisory Committee on Smoking and Health. The CDC notes that, quote, on the basis of more than 7,000 articles relating to smoking and disease already available at that time in the biomedical literature, the Advisory Committee concluded that cigarette smoking is a cause of lung cancer and laryngeal cancer in men, a probable cause of lung cancer in women, the most important cause of chronic bronchitis, unquote. So let's take an even closer look at the statistic that I gave earlier. Premature deaths caused by smoking in the 50 years since Surgeon General Terry's report. The total number of smoking-related cancer deaths caused by smoking is 6,587,000. The number of premature deaths caused by cardiovascular disease and metabolic disease is 7,787,000. Deaths caused by pulmonary disease, 3,804,000. Deaths caused by conditions related to pregnancy and birth is 108,000. And for residential fires caused by smoking, 86,000. Lung cancer deaths caused by exposure to secondhand smoke, that number is 263,000. And finally, deaths from coronary heart disease caused by the exposure to secondhand smoke is 2,194,000. Certainly, we have made some noteworthy strides in stemming the tide of American deaths caused by smoking, but we have so much more to do. So that is our topic today on Health Watch. And I brought on board a very special and knowledgeable guest that can talk on that topic. We're going to take a look at the serious public health issue represented by smoking. We also have a very small studio audience with us today, and if we get an opportunity, we're going to give them an opportunity to ask some questions, so stay tuned. My sole guest in the studio today is Jane Flores, supervisor of the Virginia Department of Health Tobacco Use Control Project and the Division of Prevention and Health Promotion, Office of Family Health Services. Welcome to Health Watch.
Thank you. Happy to be here.
I'm delighted to have you. So our relationship goes back some years, way back to 1988 when I first started working here.
98. Don't take it back that far.
Well, seems like a long time to me.
Too far ago.
Before we get into the Surgeon General's report, if you could talk to us a little bit about the Virginia Department of Health Tobacco Use Control Project.
Sure.
What is the mission and what are some of the goals?
Absolutely. With the, as you already noted, the Tobacco Use Control Project is in the Division of Prevention and Control, and we are working to really help Virginians choose healthy lifestyles through various and sundry things, whether that's chronic disease prevention and control, injury prevention, etc. Tobacco is the #1 cause of preventable death. People don't realize that that is still the #1 cause in the United States of preventable death. So we want to help people, and we have 4 primary goals, and they are the same goals that are set by the CDC, which is, first of all, to help people never try a cigarette in the first place.
Indeed.
That nobody ever picks one up, so no initiation. That we help people quit, so we increase cessation rates for people who are already using tobacco, and that we protect people from secondhand smoke. That has been something that I think gradually people are becoming more and more aware of the dangers of secondhand smoke, and then also to decrease health equity. To increase health equity. Increase health equity. Sorry, and to decrease the disparities that are caused that we see now in smoking. Many people think that the smoking war has been won. It hasn't,
yes.
And in certain groups it's particularly still high and very dangerous. So we need to deal with those inequities in health.
Okay, let's talk about some of those. So let's talk generally about statistics first.
Okay.
The prevalence of smoking in Virginia. I took a look at your website and I saw some pretty incredible things. Let's begin with giving some statistical data on adult smoking in Virginia.
Okay, right now it's predicted that about 19% overall of Virginians smoke. You'll see different rates, there are different sources, that type of thing. Sometimes one of our main statistical measures that was used for years is still being used, but they changed their weighting and how they weight their data, so you'll see some variation. But roughly 19% of Virginians smoke. However, you see groups that are as low as 3% up to groups that may be close to 50%, depending when you look at separate groups. You'll look at the fact that there's more men smoke than women by significant numbers. Many more men choose to smoke or use tobacco than women do. Most of them, however, really want to quit. When we talk to smokers, 40% have made a quit attempt in the past year, and about 64% of them say they would like to quit. So it is incredibly high as far as how many adult smokers say, yes, we want to quit using tobacco. Here in Virginia, the cost of adult smoking, it costs over $2 billion a year in health care.
$2 billion a year.
$2 billion with a B in healthcare cost for smoking-related illnesses. And we also lose between 9,000 to 10,000 people each year of smoking-related causes. So it's something that just goes on and on and on, and we just have to continue to fight this battle.
Let's break the numbers down even further and look at the disparities in smoking in terms of how smoking impacts the different groups in Virginia.
Well, you'll see certain groups, I already mentioned men in particular. Men have a higher smoking rate than women do. African Americans, when you look at racial and ethnic groups, have the highest prevalence of smoking. When you look at things such as your socioeconomic status, people who make less money, have less income, have less education, are far more likely to smoke than those who have higher educations and higher incomes. You'll also look at certain groups such as LGBT, the lesbian, gay, bisexual, transgender communities have a much higher rate of smoking. And so when you look at these specific groups, we really have to work with them. Another one that people haven't realized, I think, a lot is the people with mental health conditions and also people with other substance abuse conditions. And that's something that we're really struggling with. You know, a lot of times you go and you go to a meeting, if you look at the AA meeting maybe that's happening in your church or your faith community, what are they doing before the meeting? Standing outside smoking. Because it's not recognized as the danger that it really is, and that far more people are going to die of smoking than even the other substance issues.
So based on what you were just saying, smoking is kind of like one of those codependency situations.
Absolutely. Many people say they use it for, to help reduce their stress, that they're depressed and they find it helpful to them in some way. We certainly have to help people find other ways to cope.
Can you further elaborate on African Americans and smoking? As it appears that some of the statistical data that you have mentioned as things that we see in the African American community.
Right. It's estimated nationally that about 45,000 African Americans will die of smoking-related causes each year. So it's a tremendous cause. I think that also goes to our health equity issues too, for many reasons that we can't have time to go into here, but unfortunately we know that there are many inequities in our society, so that many people who are African American also have lower socioeconomic status, lower educational status. So when you
and these are all indicators of people that tend to smoke.
Right. So basically if you control for those, it's not that much difference between, say, African American community and the white community. But because a higher prevalence, unfortunately, again, because of other inequities, have a lower socioeconomic status, they tend to smoke at a much higher rate. Which means that you have African American men who, particularly, who are dying of lung cancer, of vascular disease, and other diseases at a much higher rate than other people do.
Yeah, health equity and health disparities are something that we have brought several times on the show, and it's something that I'm very much concerned about. I'm aware that I run the Tobacco Use Control Project for the Norfolk Health District, and I'm aware of the way tobacco companies are targeting young people. That is their principal target now, even children as young as 11 and 12 years old. Can you talk a little bit about youth smoking in Virginia?
Sure. We estimate that about 33%, a third of youth, have tried smoking. Those in middle school and high school have tried smoking. Of course, many of those do not go on to become daily or regular smokers. But we know also that most young people will start smoking, or people will start smoking typically before the age of 18, when of course technically it's not legal for them to get, I shouldn't even say technically, when it is not legal for them to obtain cigarettes and tobacco products. Virtually no one starts after the age of 25. I mean, if you think about it, do you know anybody 25, 26, 30, 40 who typically starts smoking for the first time? Probably not. So that targeting of that 18 to 24-year-old age group, which of course that sort of blends over to a younger age group, is extremely serious. We also know that about 19 to 20%, pretty much the same general prevalence of high school students do smoke on some regular basis. It may not be daily, but they are considered regular smokers. So the prevalence is about the same for high school students as it is across the state. We also know that about 336,000 young people are exposed to secondhand smoke in their home. One of the main predictors of whether someone smokes is whether or not a parent or the person raising them smokes. So that's something else we have to be really aware of. Not only are they getting the damage from the secondhand smoke, they're also role modeling the adults that they're around.
Yeah, the pattern, the patterning that takes place.
Sure.
So we've talked about the issue that we're facing. We've talked about, generally what the Tobacco Use Control Project does. But tell us about the Quit Now Virginia program.
Okay. Yeah. That is a program that we have because we really want to look at how can we best help people quit. And the research, the evidence has showed us that the primary ways that we really reach people to help them quit are through smoking bans and, not allowing smoking in restaurants, workplaces, wherever, you want to talk about, and there's lots of different options for that. But smoking bans through increasing the price of tobacco products, the excise taxes, and through mass media, effective, hard-hitting mass media campaigns. So when you have those people who are trying to quit, we want to be able to help them. So we offer, through the Virginia Department of Health, one of the programs we offer is the Quit Line, the Quit Now Virginia. It's 1-800-QUIT-NOW. It's also available on the web, so people can enroll in a smoking cessation program on the website as well. This gives people an opportunity to obtain a free service that will help them go through the process of determining a quit date, getting counseling, and hopefully making the best possible attempt at quitting. One reason it's great to now have it on the web and on by phone is that different people, would prefer. Some people would prefer to talk on phone. Some people would prefer to, sit and do it by themselves and not have the conversation. But we give them that option. If somebody calls, and people sometimes call and say, "How do I help my friend?" or "How do I help my spouse stop smoking or stop using tobacco?" We provide information on that, sort of some of the keys and tips that maybe they can help encourage the person. We also are able to provide information about local resources. So we try, whenever we become aware of a cessation program in a community, we inform our Quit Line contractor, the people who are doing the counseling, about those, that they've got a list. So if somebody calls and says, "Is there somewhere, I'd like to really just go and sit down and talk to somebody. Is there a counselor that you know of here in the Norfolk area?" Hopefully they would be able to provide them with that service as well.
And the services also include, it's a 24/7
yes,
counseling service
it's
with
24/7. So you can call anytime. There are a few hours in the middle of the night. I think it's from like 2 a.m. to 6 a.m. or 7 a.m. where you won't be able to get a counselor, but you will always be able to get information. And hopefully not too many people are calling at 3 or 4 a.m., but it could happen.
Someone having a crisis with needing that.
Someone having a crisis will need it, but they still can get some level of support, even at any time of the day. There are counselors who are both English and Spanish speaking, and there are translation services for many other languages. I believe it's about 80-some languages that they can provide translation.
I didn't realize that.
Yeah, so they can provide translation service for. We also have special services for teens that are targeted specifically to help the 13 to 17 or 13 to 19-year-old quit. And we also have services, a 10-session counseling program that is available for pregnant women, and that is certainly one of our strong target audiences as well. We really want people to realize that if they're pregnant, the risk they're putting their fetus at of early delivery, sudden death syndrome, many of those things are related to exposure to smoke in utero. So we really need for people to understand their need to quit smoking, and also hopefully encourage, the people around them who will also be caring for the baby to be able to not smoke.
While preparing for the show, I went to the CDC website, and I found the Kathleen Sebelius, U.S. Secretary of Health and Human Services, executive summary that she did on the 50th anniversary of the Surgeon General's report. And there it included a reference to the potential number of deaths if cigarette smoking, particularly under people under the age of 18, if smoking continues in the U.S. Can you elaborate on that?
That's one of the devastating things. Again, this has been designated by the CDC as one of their winnable battles, that we really believe that within a generation we could end the tobacco epidemic. If we do not, at the current rate, it is predicted that of our children who are alive today, under 18, over 5 million, about 5.6 million of them will die of tobacco-related illnesses. Here in Virginia, it's predicted about 152,000 of those children that we see, in our homes, in our playgrounds, at our faith communities, are going to die here in Virginia of tobacco-related illness. That is something that is, to me, unconscionable, and that we have to really find a way to end it in this upcoming generation.
We need to get that message out. I mean, like we mentioned at the top of the show, some 21 million people have died from smoking-related illnesses over the last 50 years.
Yeah, and people think the war is won. It's not. Yeah. It's still the number one preventable cause of death.
That's close to 10% of the population. In fact, back when the report was done, that number would be 10% of the population. So I want to talk a little bit now about the composition of cigarettes. I know that the manufacturer of cigarettes, with all this new technology, new research on drugs and addictive drugs, that the manufacturer of the composition has evolved.
Absolutely.
How has that evolution increased the dangers of smoking?
One of the things that's happened is there's so many elements, over possibly up to 7,000 elements that can be in tobacco, in cigarettes, rather, that have been added to the tobacco. And the purpose of many of those is to actually increase the addictiveness of the nicotine.
Indeed.
So nicotine's already addictive, but there are ways that you can manipulate it so that it's even more addictive.
So tobacco companies are consciously putting additives into the chemical composition of cigarettes to get people addicted and to keep them addicted.
Yes, that has been something that, and until fairly recently, until the last few years, we didn't have any idea specifically what was in any particular cigarette. You think about it, if you go to the grocery store, you pick up virtually anything these days, any package, you can see what the ingredients are. You pick up a cigarette pack, you don't know. They do now at least have to report to the FDA, the Food and Drug Administration, what the components are in each particular brand of cigarettes that they're selling. And more, I think there'll be some regulation of that. But it is something that has occurred that creates this addictiveness. You just simply don't know what you're absorbing. People also think about that the filter in a cigarette is somehow protecting them. Well, maybe somewhat. What we don't think about with secondhand smoke, there's no filter there. The person who is sitting across from you is getting the full effect of the burning cigarette and all the components that are in there with no attempt to filter it at all. And that's something that people don't think about.
Yeah, I'm sure most people don't think about that at all. I'm glad you pointed that out. So for smokers are at least getting that cigarette smoke. They're getting a direct tip, but that cigarette smoke is being filtered. But for the person that's getting the secondhand smoke, there is no filter.
Absolutely.
Now, with the evolution of the composition of cigarettes, there's also been an increase in the list of diseases that are caused by cigarette smoking. Can you expound upon that?
Sure. Whereas in 1964, when the first Surgeon General's report came out, there, as you already mentioned, there was lung cancer in men, maybe lung cancer in women. It was sort of like we're not sure. The one that came out, the report that came out a couple weeks ago, that's the 34th, I believe, report by the Surgeon General on smoking, has indicated about 12 to 13 cancers that are related to tobacco. Two of the newest ones are colorectal cancer and liver cancer, I believe, are the two newest ones. But many, many other types of cancer that are related. And then they're also looking at other health conditions that are actually caused by, I shouldn't even say the word related, are caused by tobacco smoke and tobacco. People don't think about, I was stunned the first time I ever heard that diabetes, about 12% of diabetics, the diabetes is actually, the cigarette use is a causal factor in the diabetes. I mean, I knew that it made it worse. I didn't know it caused it. Things like ectopic pregnancy and other types of problems during pregnancy are related to use of cigarettes. Things such as erectile dysfunction is related to it. Things such as gosh, it just goes on and on. Immune system, just immune system dysfunction is related to cigarette. So all these things that we don't even tend to think about how it infects our entire body, it really can have an impact on every organ in the body through the use of tobacco. And that's just something that people don't realize, how much damage is being done when they are using that for something that they think is recreational or stress reducing, that is really damaging organs and systems throughout their entire body.
That's something that the 2004 Surgeon General's report stated, that it affects every organ in the body. I heard something, I guess sometime over the last year, that actually can affect muscle tissue. That it has an effect on muscular tissue.
I haven't seen as much specifically on muscle tissue, but certainly if you think about the reduced vascular flow, blood flow throughout the body, that impacts everything because everything has to be nourished by the blood flow. So that's not one that I'm as familiar with, but it certainly is, it makes sense. It would certainly be something that every organ is affected, so that would include muscles as well.
As you noted earlier, if nothing is done in the future, over 5 million, or close to 6 million young people under the age of 18 could potentially die from smoking-related illnesses. So cigarette companies are in fact targeting youth smokers. Can you give us some example of how that is taking place? I know that some places, retail merchandising is at the eye level of a child.
Right. That is one of the things that technically the cigarette companies, tobacco companies are not to be marketing to children. However, as I mentioned earlier, when you're marketing to that 18 to 24-year-old so strongly, who is the 15, 16, 12-year-old looking up to those 18 to 24-year-olds? So they're still impacted by the direct marketing. But yes, things at eye level. There are some areas, some states where you can't see the cigarettes at all. A friend of mine, an acquaintance of mine, recently moved here from New York, was stunned to see cigarettes out in the open and not behind closed cabinets where you have to know exactly what you want, and usually a manager has to go over with a key and open it. Where there's no, they're not allowing advertising there at point of sale. So there's many more things that we could do here in Virginia to decrease the ability of youth to be targeted by the ads and that type of thing. There's also a question, it's a whole different subject in some ways, is the new marketing now for e-cigarettes. Is that, in fact, a gateway to tobacco use? There's different people have different opinions about it, but it's certainly a concern. And when you see e-cigarettes, which do contain nicotine, some people think there's just a water vapor. It definitely contains nicotine and many other chemicals, some of which are also cancer-causing agents. And they're in bubblegum flavor and grape and those types of things. They appear to be marketed to children, and children of any age currently in Virginia. Hopefully that law will change to include e-cigarettes, but currently any child of any age can go in and purchase e-cigarettes.
And e-cigarettes are not the manufacturer of e-cigarettes. It doesn't necessarily have to adhere to federal regulations. There are no regulations just yet.
Not at this point in time, no.
Before we go, I want to make sure that we give, again, we put that information up on the screen earlier, but contact information for Quit Now Virginia, as well as contact information for the Tobacco Use Control Project. Let's just quickly give Quit Now Virginia first.
Okay. For Quit Now Virginia, you can go to 1-800-QUIT-NOW, and I can't tell you the numbers.
Okay, we have it up on the screen right now.
Great,
actually.
thank you.
Okay.
But 1-800-QUIT-NOW, and also you can go to quitnow.net/Virginia.
Okay.
So either one of those you can go to reach the program for tobacco cessation. If you want to reach me, I believe my phone number is the Tobacco Use Control Project. You can call 804-864-7874, and we are in Richmond. We're located in Richmond at 109 Governor Street, which is right across from Capitol Square. And we do have a person who works with communities throughout Virginia. We also have a media and education specialist, and we have a cessation specialist who all work with me and are all available to help people in whatever questions or concerns they might have about tobacco use control.
Well, I want to thank you for coming on to the show.
I'm delighted to be here. It's important.
It really is. There are a number of smokers, and this is a state where tobacco was king for a while. Again, thank you so very much.
Thank you, Terrence.
And we want to thank you for joining us for this edition of Health Watch. If you'd like to send me any questions, you can reach me at terrence.affer-anderson@vdh.virginia.gov. You can also give me a call at 757-683-8836. Again, that's 757-683-8836. For the Norfolk Department of Public Health, this has been Health Watch.